Bell's palsy is a very specific condition, and it involves a sudden onset of a facial paralysis, a condition where you're not able to raise your eyebrow, where you're not able to close the eye, you're not able to smile on that side, and typically patients think they've had a stroke. No other defects or problems occur. For example, they can still move their arms okay, they can still move their legs okay, but they have this facial paralysis. Typically, a patient who has a facial paralysis that is thought to be Bell's palsy has some improvement spontaneously over the first 3 weeks after onset. Typically, patients with facial paralysis of sudden onset are treated with steroids and antiviral medications. A sudden onset of facial paralysis that does not improve over the first 3 weeks of time is not Bell's palsy. Oftentimes, Bell's palsy is used to express facial paralysis, but facial paralysis can also occur from tumors of the parotid gland, the salivary gland in front of the ear. Facial paralysis can also occur from facial nerve tumors, benign tumors that affect the facial nerve primarily. Patients who have slowly progressive facial paralysis do not have Bell's palsy and require further workup to rule out a parotid tumor or facial nerve tumor. Percent of patients with Bell's palsy completely recover. When the facial paralysis is sudden in onset and the face is completely paralyzed, electrical studies are recommended. Electrical studies determine the degree of degeneration that's occurring within the facial nerve. There is a very small population of patients with Bell's palsy who have a completely paralyzed face that require surgical decompression of the facial nerve.